Hello everyone, Dr. Kamondoza here. Today, this video is all about how chronic kidney disease completely changes lives in a big way. This condition often progresses without symptoms, with many people not even knowing they have got it until it is quite significantly advanced. Knowing these changes is key in early detection and management. We will look at the symptoms, causes, treatment, and lifestyle adaptations at large over this condition. How does chronic kidney disease present? What are the warning signs you should look for, signifying that something is wrong, that medical attention is required? Which are the warnings that you should actually sound the alarm and find racing to the doctor? Fatigue is one of the first and most frequent symptoms. It is not simply being tired, it is severe unremitting tiredness that does not get better with rest. This can lead to the feeling of increasing drain in your body and more weak with each day passing, since toxins add up in your bloodstream. It can then start to intervene with your performance in daily activities or your overall quality of life. Your kidneys will stop performing the regulatory function for fluids, so you might start noticing swelling in places like your ankles, feet, or face. Such swelling is commonly uncomfortable and worrisome. Changes in your urine may also be a sign of a problem. This can include changes in color, consistency, or amount. Do you find that you have to urinate more often, particularly if this means you need to get up more during the night than you used to? This can deprive you of needed rest and increase fatigue even more. Do you notice blood in your urine or it is forming? These are severe signs that you should not even ignore. These may be symptoms that your kidneys are not working as they should. These deuterium developments are important to note and to consult a doctor about. Some of the symptoms are subtler, aspirating constant itching, nausea, or a metallic taste in the mouth. These may be easy to ignore, but they are significant indicators. You may sweat a lot or suffer muscle cramps, especially at night, or feel a continuous coldness of your hands and feet. These developments can affect your comfort and general well-being. It is therefore important to remember that these symptoms could connote other health problems. Hence, a personal diagnosis must be made through your doctor. Do not diagnose yourself. Seek professional medical option, but do not ignore these indicators either. Early detection will slow down chronic kidney disease. Early intervention can make a very large difference in handling your health. It is because of this that diabetes and high blood pressure are the two largest offenders in this case of chronic kidney disease. What makes each of these so dangerous is that you could go years without knowing you have them, damaging your kidneys the whole time. These two disorders damage the blood vessels of the kidneys. Consequently, your kidneys won't be able to filter waste as effectively. Gradually, this is likely to cause extensive damage to the kidneys. If you have a family history of kidney disease, you are too at increased risk. Genetics play a very important role in being prone to suffer kidney disorders. There are several genetic disorders such as polycystic kidney disease, whose adverse effects are directly targeted at disturbing the functionality of your kidneys. This is the kind of genetic disorder that results in the forming of cysts in the kidneys. Therefore, the kidneys increase in size and eventually function in a poor manner. Other reasons for damage to the kidneys could be from long periods of taking some medications, including the over-the-counter painkillers, autoimmune disease like lupus, and repeated kidney infections. These ultimately result in continuous inflammation and scarring of the kidneys. Uncontrolled high blood sugar and high blood pressure put a tremendous weight on your kidneys. That increases damage and lessens functionality. Hence, management is essential in preventing both monitor and regular checkups some conditions on a regular basis to dramatically reduce your risk of getting these diseases. Maintain a healthy lifestyle by exercising regularly. Ensure a proper and balanced diet and avoid smoking. Eat more fruits and vegetables. Drink adequate water and avoid too much salt in order to make exemplary turnout. Although chronic kidney disease is such a severe condition, it can be controlled truly timely and right treatment after the detection of the disease. The most important reason why early detection is so vital is that it may increase treatment choices as well as slow the progress of kidney disease. Based on the stage of the disease, treatment for CKD is individualized for each patient. As an outcome of this individualized method, every single patient receives the most effective therapy. Medications that lower the blood pressure, cholesterol, and control of blood sugar in diabetes patients are at times recommended. These drugs are shown to be quite useful in being helpful and preventing other worsening conditions. This helps protect your kidneys from deteriorating more in the future. They reduce the workload on your kidneys by keeping your blood pressure and blood sugar levels under control. Later in the disease process, once your kidneys can no longer adequately filter waste, dialysis may become a lifestyle-saving option. That's the work of your kidneys. It removes waste products and extra fluid from your blood. This is because the process helps in maintaining the fluids and electrolytes in your body. Hemodialysis and peritoneal dialysis are the main types of processes. Hemodialysis is in the process with the help of a machine that filters the blood inside your body. Peritoneal dialysis is performed by instilling some special type of fluid inside your abdomen to take out the waste. Each type has its own advantages and some negativities that must be reflected upon. In some of the cases, a person even has the option for getting in with the process of kidney transplant. This is often considered when dialysis is no longer effective and suitable. This is a surgical procedure to replace your damaged kidney with a healthy one obtained from a donor. A successful transplant can significantly improve your quality of life and reduce the need for ongoing dialysis. Both raise different concerns and carry a variety of potential risks, but both put forward hope and possibility for a good life. Benefits and risk of each of the options should be carefully weighed against one another. An open and honest conversation with your healthcare provider will help decide the best treatment for you, the person, and your circumstances. You and your healthcare team will work together to develop a plan that fits your lifestyle and health goals. One may wonder further on whether a patient with chronic disease should be required to do exercise. The response remains the same, but importantly, such exercises must be safe and moderate in that case. Consult with your doctor to make a plan for exercise suited for your specific condition and level of fitness. Low-impact activities are usually well tolerated and may include walking, swimming, and riding a bicycle, while they are good for improving one's cardio health, muscle strength, and overall well-being. Remember not to overexert yourself, as this can also place undue stress on your kidneys. Begin slowly and build up the intensity and duration of the workout regimen. When you feel fatigue, take a break. Make sure to drink ample water before, during, and after the exercise. If one starts feeling unusual fatigue, short of breath, or any kind of discomfort, one should immediately stop the exercise and consult a doctor. Diet is a critical component in managing chronic kidney disease. Normally, the kidneys perform excretory functions within the body, and given the fact that several foods make them work more than they are supposed to, when filtering waste products from the blood through these blood cleansing organs, the two most important dietary changes are limiting sodium intake and watching potassium closely. Healthy kidneys balance the levels of potassium, whereas their function is too low, leading to potassium accumulation in the blood with dangerous complications. Another mineral that is managed carefully is phosphorus. Reduced kidney function results in the accumulation of phosphorus in the blood, contributing to impaired and weakened bones, as well as an increased risk of heart disease. A doctor or registered dietitian can work with you and develop a custom meal plan that will not only satisfy all your nutritional needs, but also take good care of your kidneys. Having a chronic illness like chronic kidney disease can impact your social life and relationships. You might find yourself it's overwhelming hard to be engaging in activities that makes you happy and satisfied due to so many factors like weakness, food restriction, or need to always undergo dialysis. The emotional and the physical demands involved in taking care of your condition might also bring about social withdrawal from others. it is essential to remember you are not alone. Communicate openly and honestly with loved ones about what you need and how you are unable to meet their needs, whether it can be actually going with you to your appointments, helping with meals, or just being there to talk with you. Tell your loved ones what is wanted from them. It can be an arena to share those experiences and gain emotional backing. The uncertainty of what will happen, how will it affect your daily life, and how it may lead to various complications that can be pretty harsh on you. It is pretty normal that in such a situation, a person is constantly anxious, stressed, or even depressed with a state of mind. Never hesitate to seek out professional help if you find coping too difficult. Remember, as mentioned for the millionth time, early detection is very important in slowing chronic kidney disease progression and maintaining your quality of life. Reach out to family, friends, or healthcare workers and educate yourself consistently on the condition. Take good care of yourself and contact help at the silent suspicion of chronic kidney illness. Enjoy this video? Hit the like button and subscribe to our channel for more health videos. Please leave your questions in the comment box below. Until we meet again in the next video.